Hi, I'm Dr. Buddy Hammerman, Chief Medical Officer of Select's Critical Illness Recovery Hospital Division. I'd like to take a few minutes to talk to you about our approach to caring for patients that are recovering from critical illness throughout the country in our facilities. As you know, our patient population is made up of patients that have unfortunately suffered from critical illness in which they've received very highly specialized care in acute ICUs across the country. The care that they have received has been exemplary, and we respect those team members that provide that same diligence and care across the nation. A multidisciplinary team is a set of providers linked together to discuss patient intrinsic details in order to work through all of the established challenges that a patient would have in order to recover from a catastrophic critical illness. All being able to discuss with each other those key elements that would factor into a collaborative approach in order to facilitate improvement in a patient's progress. This is a patient population that oftentimes comes to us from the intensive care unit with multiple issues and multiple comorbidities. A comorbidity is a set of illnesses that comprise those issues around unfortunate catastrophic illness. For example, a patient that may have undergone a bout of respiratory failure resulting from both congestive heart failure and pneumonia. Those are comorbidities. Sometimes patients come to us with 7 of those comorbidities, inclusive of diabetes or bad blood vessels, vascular disease. So it's important for the entire team to discuss things that emanate around nutrition and ability to wean from the ventilator, make sure they're on the right medications, make sure that medications are discontinued in a timely fashion, make certain that they are not on antibiotics for too long of a time, or that the team is discussing those key elements that the family has been able to relay to us about a patient's perspective. We are able to then discuss with family members and with patients their progress. Because the team is aligned, we're able to understand those things that may impact everyday challenges. Inability for the patient to get up and walk, inability of that patient to eat or talk or wean from the ventilator. On a regular basis, the entire team is aligned, sharing this information and able to develop plans on a very timely basis to move that patient forward in their care. Finally, it's important to us to continue to have a discussion around the development of multidisciplinary teams at each one of our hospitals at the bedside in order to facilitate those 5 functional recovery items that we focus on every day. Our goal is to get the patients home back to where they are best, eating, walking, talking, and thinking again. Those are those key elements that we are focused on every single day in every single discussion that these teams have at the bedside. This is our driving and burning platform. This is the important thing that we need to do on a regular basis to functionally recover our patient population.